Hi guys, it's Dr. Blackett again from Yada Yada Health. Today we are talking about the ins and outs of the first trimester and what you need to know. Remember, I've taken the most common questions asked by my patients and I'm presenting those to you. The first question I get is, when should I call for an appointment? You should call your provider as soon as you find out you're pregnant. They'll usually schedule a few different appointments for you. One of those may be for an ultrasound, depending on your past history. The way we do it in our office, you actually come in and meet with a nurse. She goes through all of your history first, and then you meet with me or whoever you have as your provider at around 10 weeks gestation. At that visit, we usually do an exam and an ultrasound to make sure that, number one, there's only one baby in there, and number two, that you are as far along as you think you are. At that appointment, we also want to talk about things like we're talking about here. What you need to know about your body and how you need to take care of yourself during this first trimester. Morning sickness is something that is unavoidable. I get asked all the time, what can I do for morning sickness? There are a lot of different options that are very safe. When you come to that first visit, we'll talk about those. But some of the things that you can do at home are eating more small, frequent meals. Sometimes stomach acid is a problem, so some Tums or some antacids can help. And we found that actually a little vitamin B12 with maybe half of a Unisom can also help get that morning sickness in a more manageable place. When should you tell your family? Well, that is a personal decision for sure. But once you're through the first trimester, at around 13 weeks, the miscarriage rate goes down to less than 1%, and that's what most people are worried about. Sometimes they don't want to tell their family until they know that everything is going just fine. So basically, whenever you're ready, but if you wanted to wait, usually 12 to 13 weeks is a good time. How much weight should you gain? This is also something that varies from patient to patient. They used to say 25 to 35 pounds. In fact, usually that's still the average. But depending on your weight when you start, you actually may not gain very much during the pregnancy. Or if you're lower on the weight spectrum, you may gain quite a bit. So it'll vary depending on your body type. Can I exercise? Absolutely. Definitely exercise during pregnancy. If you have some complications or some problems, then your doctor will talk to you about maybe sitting it out for a little while. But if everything is going smoothly, you can usually exercise in the normal regimen that you did before. Pregnancy is not the time to start a brand new exercise program. So maybe take it a little easy on that end. But if you have been exercising regularly, you can keep it up, and your pregnancy will actually go smoother if you do. What diet modifications do I need to make? Well, with pregnancy, you want to make sure that you are eating a well-balanced diet. Plenty of fruits, plenty of vegetables. We actually do need a little fish in pregnancy, but you want to stay away from fish that may be higher in mercury content. That might be like tilefish, king mackerel, shark. I live in a landlocked state, so we don't really have to worry about that too much here. We have to worry about people not eating enough fish. It's actually good to get a little fish in your diet. Caffeine consumption should stay usually less than 200 milligrams, and you do want to stay away from some soft cheeses, things that might be like in queso. How early can I find out the sex of the baby? This has changed over the years, and believe it or not, you can usually find out what you're having by around 9 weeks of pregnancy. There are various tests available now that can test for fetal DNA circulating in your system. They're pretty accurate, not always 100%, but they They're pretty right on. So something you can talk about with your doctor when you come to that first visit is if you wanted to have one of those tests performed. That's it for the first trimester, guys. When you hit your second, then come and visit me again.